This presentation will review the breast assessment of the male and female, axilla regions, and then regional lymphatics of the chest area. So in reviewing anatomy, we have mammary glands when we're pregnant, and we have this fatty tissue here, and it extends all the way up into the axilla, and so do lymphatics. And this is an area we definitely want to make sure we touch on and feel whenever we are looking for signs of breast cancer. So in a mature non-lactating breast, we still have the ducts, they're just not producing milk. And of course, in a lactating person, then we will have these fill up with breast milk. There's different quadrants of the breast, almost like the abdomen here. And so if you felt a lump or anything, you would document which area that you would notice it in. But you don't need to memorize these quadrants for health assessment. There are extra nipples that we call supernumerary nipples. I have seen these a few times in my career. They're nothing to be really concerned about. It's the extra nipple that develops along the tract of the mammary ride line here. It's a nipple that's inverted and flat and it has no alveoli. It actually almost looks like just like a mole. In puberty, in adolescence, estrogen stimulates breast changes first. At the age of onset is around 11 and 12, sometimes earlier than that for breast development. And you'll see here the ages that breast development usually kind of starts a little bit. If they have obesity, they'll start this at an earlier age. We use the sexual maturity rating in girls called the Tanner scale. So Tanner staging, be familiar with the Tanner staging. When menstruation begins, that's stage 3 or 4 on the Tanner scale. The pregnant women, changes in the breast start around the second month. They enlarge, more nodular. The nipples darken, they become larger. In the 4th month, they could possibly express colostrum, which is a thick yellow fluid precursor for milk, rich in antibodies. Breastfeeding is important and recommended by the AGA up until age 2. Well, actually age 1, but you can up to age 2. So at least for a year, they recommend exclusively breastfeeding. For milk production, 1 to 3 days after deliveries, when it comes, it's a white color. It has fat and calcium in it. In our aging women, we have breast tissue atrophy. Everything gets low and saggy. So decreased breast size, drooping, flattens out. The male breast, a flat chest is normal. During adolescence, they may have some gynecomastia, which is enlarged breast in the male, but it can be temporary in the adolescent period. If it reappears in the older male, it's possibly due to medications or testosterone deficiency, so an overabundance of estrogen as well. Could also be an indicator of some other diseases, so we need to investigate gynecomastia. Which culture and genetics? Of course, some genetics influence breast cancer, especially the estrogen receptors, HER2, and BRCA1 and BRCA2 genes. Those are inherited mutations, makes a higher risk for cancers. We can do genetics testing for that. Jewish women have a higher risk for some breast cancers. Breast cancer survivors' 5-year survival rate depends on their stage of diagnosis. Blacks have an 83% survival rate, 5 years. Whites, 92% 5-year survival rate. The screening mammogram for age 40 years old and up. So at age 40 is the screening mammogram that should be completed every year, so annually. Lifestyle should be ETOH, alcohol increases the risk of breast cancer, and postmenopausal hormone therapy is not a risk for breast cancer. And there was a study done in 2001 that scared everybody, but they debunked that study. It's not scientific any longer. So hormone therapy does not increase the risk of breast cancer. If you're overweight, you have a 1.5 times more chance of having breast cancer, and if you are obese, your breast cancer chances are doubled. We want to look at subjective data, any pain, lumps, discharge, rash, swelling, trauma, any history of breast disease, surgeries, radiations, any medications you're taking, previous pregnancies. Do you do self breast exam? Look at the risk factors? Observe the axilla, any tenderness, lumps, rashes, pre-adolescence. Have you noticed any changes in your breast? Pregnant women, any enlargement or fullness. For menopausal women, do you have any changes in size or firmness? Objective data, inspect the skin, look at the nipples, look for supernumerary or third nipples. Okay, and then palpate the breast for any lumps or lesions or pain. And the male, you're going to do the same thing. For the breast exam, note any masses, location, size, shape, consistency. Does the lesion move? Is it distinct? Is it make sure you check behind the nipples as well. Any skin over the lump, any tenderness, any swollen lymph nodes in that area. Teach self breast exam. The best time to do a self breast exam in menstruating women is 4 to 7 days after the menstrual cycle. In both menopausal women, they can do it anytime, and they should do it at the same time every month. So at least once a month, checking both breasts. In order to do the self breast exam, you want to have them lay down, go in an up and down motion, and up and down pattern in a circular motion over the entire breast and also into the axilla area. Okay, you want to have them then stand up or sit up and also look at the breast and axilla areas, feel there, and then look for any dimpling when you hold your arms on your side. You're looking for dimpling or abnormal lumps or just something that's abnormal. Witch's milk is clear white fluid, which usually dissolves within a few days. With infants, it's nothing. Adolescents, girls 8 to 10 years old for development, and then premature thelarche is early breast development with no other signs. Delayed development is hormonal failure, anorexia nervosa, or severe malnutrition. Precocious development occurs when puberty occurs before age 8. Usually due to thyroid dysfunction, so you want to check for thyroid issues, or if they're taking Bestrol, which is an anti-anxiety drug, or they have maybe an ovarian or adrenal tumor. So cancer knows no age, so we should always be aware of abnormalities at any age. A pregnant woman can have a delicate blue vascular pattern visible over the breast. That's totally normal. Increase in breast size, the nipples become darker, more erectile, and the areolas get wide and dark. Colostrum is the first breast expression out of the breast after the first trimester and up to a few days after delivery, and then the whole milk comes in. And that lactating widowed. So we have the colostrum, that's the first full rich antibodies milk production, and then we have the full milk that comes in around 3rd day postpartum. We want to look for signs and symptoms of mastitis, so engorged, enlarged, red and shiny, and painful. So painful and fever, red engorgement would be an indication of mastitis. With aging women, we want to observe for breast cancer signs. Their breasts are naturally more pendulous, flat, and saggy. We want to promote self breast exam in every age.